Thanks so much, Mahmoud, and hello, everyone. Thank you so much for taking the time out of your, I'm sure, busy days and schedules to join us here on this conversation. And we are also committed to having conversation at the end. So we'll keep our remarks to about 10 minutes each, so we have lots of time for that. I think I just wanted to provide some overview before I turn it over to Dr. Hamilton Page and Michelle Robichaud to really talk more about the example we're bringing in. And that overview really consists of a couple of points. One is the why of this. Why are equity informed processes, social justice informed processes important to disaster and emergency management and to climate action? And I think, there's a moral argument for sure that that's just the right thing to do. And also there's a very practical and pragmatic argument for it, which is that in this day and age, and particularly in the context of disasters being fueled and amplified and extended by climate change, there's a real need to be more effective in terms of our planning for and mitigation of disasters, reducing disaster risk, and in responding to and supporting communities and individuals and regions and countries really recover from the disasters that are unavoidable. And to do that well, we know, and the research is very clear on this, and some of you I know are in the program and also familiar with the research. The research is very clear that disasters are not equal opportunity events. They amplify patterns of inequity and vulnerability and resilience. So they really amplify what is already happening in communities and regions. And what we know is already happening, and certainly in this current time is being highlighted for us in a really horrible way in the country south of us, but is also happening here for sure, that equity, diversity, and inclusion are under attack, and that people who experience disasters, who are already experiencing things like poverty and racism and sexism and lack of housing or underhousing, all of those things that we know are at play in our society today, those people are first of all impacted more typically. They're often living in more vulnerable areas geographically within a community. They also have less access, sorry, to the resources that come into a community or a region in the midst of a disaster. And those might be resources immediately in the response, but also throughout the recovery period, which we know lasts for years and sometimes decades. And so we know that in order to be effective in disaster and emergency management, in order to be effective in health emergency management, in order to be effective with climate action, we need to understand where vulnerability exists and how it's constructed. And so, the program, the MA in Disaster Emergency Management and the MA in Climate Action Leadership, both have as foundations an understanding of what we would describe as a social construction of vulnerability and resilience. That is that vulnerability doesn't just automatically, you get to be vulnerable and you get to be resilient. It's constructed in the ways we construct our societies, in very much influenced by the finances that a family and an individual have, the finances and economic resources that a community has. And so we know that these things play out in disasters in really clear ways. As I said, there's lots of research on it. And that if we're going to respond to people and if we're going to help bring people along into the planning for disasters and trying to reduce disaster risks, which again, in this day and age is really where disaster and emergency management is shifting its focus to, that we need to include people in ways that work for them. We need to recognize the differences in abilities and access to resources. We need to understand the differences in access and robustness of social networks, etc. So this is a really important topic. And it's not that it hasn't been a topic in disaster and emergency management prior to this. But it's becoming that much more important, and we're seeing that also in the exercising of Indigenous rights and recognizing that, for example, in the wildfires here in British Columbia, those that are evacuated, and this is true in other statistics, that Indigenous peoples are overrepresented in those who are evacuated and often are out of their homes and communities for much longer. In the Sendai framework and the large international policies, and here in BC, our new emergency management legislation emphasizes this need to be inclusive, this need for more global and participation within society in disaster and emergency management, and a more proactive approach. So really thinking through, how do we reduce risks? How do we amplify and increase resilience? And how do we involve people in the whole cycle of disaster management, which includes preparing and mitigating, includes response, which in many cases they're already involved in, and it includes this long period of recovery. So this field is a field like any other field that is ideally, and I would say certainly as evidenced in this program and others, characterized by ongoing learning and ongoing evolution. And it's that continual learning, and in some cases transformational learning, that we're here to talk about. And we're using an example from the MA in Disaster and Emergency Management program, the course that Mahmoud mentioned, called The Human Dimensions of Disaster, as an example of a way to bring people into this conversation about equity and social justice and where power and privilege reside in each and every one of us. And these conversations can be very difficult and challenging conversations. So within this course, and I'll turn it over to Michelle now, within this course, we have attempted to construct a course that invites students into these challenging conversations in ways that allow them to explore how power and privilege exist within themselves and in their lives, and then extend that to understand, how do disasters get constructed? What are those underlying historic patterns of ways of living and being, and the systems that are involved? How do those historic patterns create social vulnerability and create vulnerability in general, and also create and can support resilience? So we're describing this approach, and I'm going to turn it over to Dr. Hamilton Page to talk more about the course Human Dimensions of Disasters as an example. Over to you, Michelle.
Thanks, Robin. So Robin and I team teach this course, have in the past for several years, and I also team teach with Dr. Patricia Stukes. So I am picking up what you're putting down and happy to run with and build on some of what you're talking about. So welcome, everyone, and thank you for joining us. Mamu, just a note that I'm folks from Royal Roads that they're struggling to join and they think it's a server issue. So just so you know, there's still folks trying to get onto the call. So Robin's talked about a few frameworks that are sort of at a global level, like the Sendai framework, that talk about social conditions related to the social causation of disaster. And so I want to talk a little bit more about some of the frameworks that are available to you that we also reference and dive deeply into over the course of 9 weeks. And there are a few cohort members who are currently in the DEM 504 course right now who are joining us today. So welcome. You're going to hear from someone else who's taken the course and is doing her research. Michelle has gone the whole way through the program and is now off on her own doing her research, and I'll let her talk about that too. So when we presented this the presentation the first time at the Transformative Learning Conference in Italy, both Michelle and another cohort member, Kate Jenkins, were with us, and we did a bit of a fishbowl, so we're trying to sort of talk about that again. So I'll talk a bit about the course, but also then frame it within some courses that you can access and some frameworks that you can access, whether you're taking DEM 504 or not. So federally, we know that the government of Canada makes accessible and asks federal staff, employees, to take the Gender-Based Analysis Plus. And this is one of those frameworks that help us develop a lens around privilege and bias in relation to what we often talk about also within the DEM field as the social determinants of health. So those things that are social locations or identity vectors that make up who we are, like our race, our class, our gender, our immigration status, our level of education, our sexual orientation, and some some of the ways that social determinants of health are constructed are more expansive, and some, like with World Health Organization, keep it short and simple, but then they'll often refer to vectors of health equity issues. So that might include communities like the 2S LGBTQ or the queer community as well. They're not exactly rolled into that World Health Organization definition, but they are impacted by that, by health equity issues. And so the way that Kimberly Crenshaw frames it is around those intersecting social locations, or the way that they come together and they interlock to very often compound in our framework around social vulnerability and resilience vulnerability. So that my gender, my sexual orientation, my class, possibly my level of education, will all come together to either support my resilience during disaster and or have an impact on the progression of vulnerability. And so those frameworks, the intersectional framework, which would also fall under critical theory or critical race theory, as well as the GBA plus, those two are both available online. The GBA plus has an online course that you can work your way through. But basically what we're trying to do is we're supporting students to develop, through the use of these frameworks, a lens, a way in which to view the world that understands both our own social location and our intersectional social location as it relates to social determinants of health. So we work with students to develop what we call praxis, or this idea of a self-reflective practice that has me look at my own social location and disclose that also as a professor and instructor, and be able to talk openly about that, and how things like, for instance, my unearned white privilege might impact how I am perceived by clients or patients, depending on the field that I'm in. And so we use that intersectional framework, or Kimberly Crenshaw's intersectional framework, to relate it to the social determinants of health. And then within DEM, we're talking about also frameworks specific to DEM, like the pressure and release model, or Wisner's model, that looks at the root causes of disaster, the social causation of disaster, in relation to those systemic causes that, like, for instance, in this course, we use Katrina or New Orleans as our case study. And so we're looking at causes like what enslavement might have done in that location to impact where people lived, their level of socioeconomic status, education, and on and on. And we link those social determinants to the systems that create those root causes that can lead to that progression of vulnerability. And so you can see how, starting at a getting used to language around race and class and gender, my own, talking about where I, as an instructor, hold privilege, where I might also experience systems of oppression, and linking that to a case study like Katrina as a disaster, starts to allow us to break down some of those, what we call dynamic pressures, or lead to unsafe conditions that are related to social determinants and related to systems and power. So that, in a nutshell, is what we're working on over 9 weeks in this disaster and emergency management course, the human dimensions of disaster. And we start off, we finished talking about climate change, but we contextually link disaster, cascading disaster. Certainly here in BC, we're very aware of how disaster is also connected to climate change, and how we're experiencing with things like the heat dome, other kinds of case studies that we could also parse apart of the over 600 people who died in the heat dome, what was happening for them in terms of the social determinants of health, what was happening in terms of services, what was available around, what policy was either addressing the vulnerabilities of those populations or not, and what needs to be developed to do that in future. So this is the link between climate change and the compounding, intersecting social location of individuals, and that progression of vulnerability, are things that we're really interested in connecting the dots between the same kind of models we're using, like the pressure and release model in disaster emergency management, and the way in which communities are exponentially impacted by climate change here in Canada. So for instance, we know, and Robin's talked about the research that exists, that Public Health Agency of Canada released a rapid review talking about the intersecting vulnerabilities related to climate change. And in 2023, 42% of the people that were evacuated due to wildfires in Canada were Indigenous, although Indigenous populations only make up 5% of the population here. So that kind of a study allows us to look at our current context and talk about the ways in which social location can lead us to talk about the systems that might be involved in increased vulnerabilities. And in that case, we would be also spending some time talking about colonization. So these are the links that we're trying to make through the course and to climate change, and working with students over the course of 9 weeks to start with themselves with that praxis or that reflective practice to learn how to use language around race and class and gender, sexual orientation, immigration status, get comfortable with talking about populations, population health, and the social determinants, and do that without othering or making other individuals who might not share the same social location as me, and then reflecting that in a case study around Katrina, and then more broadly related to climate change. Yeah, so that's a little bit about the course. And so we presented this, the first time we presented this was about at a transformative learning conference. And Robin and I thought that would be fantastic if we went as faculty and talked about how transformative the course was, but it would be it would have so much more impact if we had students talking about how they perceived the course and the program in relation to what they brought into both DEM 504 and the DEM program, but also how they engaged together as a cohort. So Michelle was there at that first inaugural conversation, and I want to invite Michelle now to add to this discussion and build on what we're saying or take it in a direction that works for you.
Sorry, I'm not so great on my telephone. Just let me know if you can't.
We can hear you, Michelle, and take it away. You've got about 10 minutes.
Perfect.
We can hear you, we can't see you, so I don't know if you have to pick one or the other.
I think I do. So I'm just going to start talking, and thank you for having me. And I am one of several nurses in the DEM learning space at Royal Roads. And we kind of straddle two traditionally siloed fields, in my opinion, and hope to offer a transdisciplinary perspective. So my past healthcare experience has led me to really appreciate like the value of the ICS and command structures for like DEM response, because we use similar top-down processes in acute hospital settings. But as I think we all know, both disaster management and healthcare are more than just emergency response. So currently I practice in public health, where clients actually get to choose to engage voluntarily. And our nursing support focuses instead on prevention and health promotion, which I liken to mitigation and risk reduction and preparedness in DEM, and that could be incorrect, but that's where I'm leaning. So in public health, we work directly in people's homes when they have them, and are challenged daily by systemic barriers reflected in the SDOH's social determinants of health, including things like food insecurity, housing access, lack of health insurance, language and capacity issues, lack of employment, and more recently, climate change, or we're calling it sort of planetary health. So public health work is couched in the foundation of lowering barriers to improve access to healthcare. And I believe that disaster management likewise benefits from understanding these barriers and by inviting clients to engage with us on their own terms. And I think that's especially true, for example, when we're talking about mitigation or long-term efforts to decrease disaster risk. And so I think this contextualization of where people are situated is where I'm most excited to see a shift in DEM, because we know that we can roll out sandbags at a moment's notice. But do we actually understand what factors in social vulnerability might be influencing a family's ability to participate in an evacuation plan? Were citizens actually engaged in building lasting resilience in the process? And please notice I did not say comply with evacuation orders. And that's the shift I'm hoping to see. So one of the questions Robin and Michelle asked me to answer is where I felt some of the greatest resistance in DEM 504 or 503. And I did feel like there was a prevailing sentiment of we did the best we could attitude instead of a how do we do this better next time. So I felt like there was a lack of curiosity, which was replaced by defensiveness. And so for me, the ideas of power and privilege are interesting here because in nursing, they are interpreted as our responsibility as nurses to serve all equitably. So our position of power as health experts requires us to examine our privilege so that we don't operate from a biased lens. So nurses are also mandated to reflect on their practice regularly and review program effectiveness. So for example, we look at vaccine rates and why they're lower in certain areas. And then what is contributing to this trend? And then how do we work around it with the community to improve outcomes? And my program right now is serving all of the families we serve to understand how we can support them better as they reported to us. And so I think, I hope this is the strength of transdisciplinary classrooms and how we can transform learning spaces. And DEM itself is by having students with regular reflective practice in their own professional lives, who normalize the use of the social determinants and assessing those and contextualizing those, and who operate from a trauma-informed lens. So here's where I might go off a bit to the left, and Robin and Michelle, redirect me if you want to. The idea of being trauma-informed is where I think this program could be more intentional. So I believe that disaster and healthcare can be traumatizing for practitioners. So understanding the trauma brain is critical in understanding yourself. And how can we, if we don't already know and recognize it in ourselves, how can we recognize the same in others? So I think before asking DEM students to recognize trauma as one of the social and human dimensions of vulnerable populations who are experiencing disaster, it behooves the entire program to ask for that self-reflection and self-awareness for practitioners who may have trauma inflicted on themselves working in disasters. And I think that's where I'll stop.
Thanks, Michelle. And you're not off track at all on that. I was just going to put in some resources around trauma-informed practice. But I think, one of the things that we talked about when we were at the conference in that fishbowl that we wanted to bring in, and maybe this is a way to open up the conversation with yourselves, which is none of this was particularly easy. It's not that there weren't people like Michelle and others who embraced this notion, who were probably more familiar with it in the first place, who this idea of self-reflexive practice or praxis. And within that, it's a certain kind of self-reflection, which is bringing in the kind of critical theoretical lens or intersectional lens that Michelle talked about, to really look at, and have the instructors do that as well. In fact, the instructors model this as they, work in the course, which is, where's my privilege and power, certainly as an instructor with an evaluation component over you, but also because I'm white, I'm a faculty member, and so I've got economic privilege. There's all kinds of ways in which I embody privilege. And Michelle and other instructors will have those conversations as well, and invite students to, within their own teams and within larger discussions, so it goes back and forth between teams discussions of which Michelle and I, or Michelle and her other co-instructor, are not a part of, but are happy to be involved in when asked. So we have these discussions, and when we encourage students to have them. And there is, for many, resistance. And really, I think, we were talking about this as we prepared for this webinar, and talking about, this is really in many ways a change process for many people, not for all, but for many. And so we know when change is afoot, there's often resistance, there's often fear and uncertainty. Sometimes it's because it's coming into conflict with existing values or an existing understanding. I think, Michelle, you mentioned that, Michelle Robichaud, that we're doing the best we can, and we always assume that people are doing the best they can, but we also assume that, especially in a learning environment, and I would say the field as a learning environment, that we're all striving to do better, that requires some discomfort. Stepping out of what is familiar requires stepping into discomfort and sometimes fear and uncertainty, and that's part of learning theory, really. You don't, when you're in that inner circle of everything I know and trust and whatever, you're not learning. You may feel comfortable and it may be a great place to be, but to learn, you have to go beyond that. So we're really inviting students into a change process, and in some ways, mirroring within the course that change process in the field. So it's not as though whether policies like the Sendai framework or the new emergency management legislation in BC invite and ask for participation and inclusion, and talk about diversity, and certainly talk about Indigenous and working within Indigenous nations and communities, that doesn't automatically happen. And so part of what we try to do, and I'm sure imperfectly, but is to create enough safety within the classroom, partly by modeling and partly by the structure of activities, etc., that people can step into that zone of uncertainty and learning and think about, well, where do I embody power? Where do I embody privilege? And then start working from that place to translate it into a consideration of how that plays out in disasters. And as Michelle, Michelle Hamilton Page described, the course focuses on Katrina, which is now a long ago disaster. And it's not because we're lazy and haven't updated the course, it's because it's such a clear example of where these issues played out in really horrific ways, in some cases deadly ways. And it helps support this unpacking of disasters, looking at, Michelle also mentioned the PAR model, the pressure and release model, which helps unpack the disaster and say, I am often saying to students and to others, there's no such thing as a natural disaster. There are natural hazards that can become disasters. And it's the intersection with us as humans and our societies and the systems we create and live in that make it the disaster. And so, it helps unpack that and start exploring the ways in which our response to disasters, our planning and preparation for disasters, our recovery from disasters, all need this more nuanced lens. It's not a one size fits all. And it's not making assumptions that we know what a certain population needs or a certain group needs or what they have access to. So it's really asking for change. It's asking for change, and change is hard. And these conversations, because they start with the self and require that self-reflexivity and vulnerability, are hard conversations. So I don't know if you have anything to add, Dr. Hamilton Page, to that. And then I think if not, I mean, if you do, great. And if not, then we'll open it up to a conversation about your thoughts about this topic of how we bring a greater social justice and equity focus into what we do in emergency management, particularly in the context of climate change. And I say that because climate change, as we know, is accelerating and amplifying disasters and creating new disasters that we've never experienced before. And so it requires a whole of society approach. Michelle, do you have anything to add?
Yeah, there a couple things. Thank you for that. I just wanted to contextualize again that we are in a time of rising populism and authoritarianism, and the backlash. While we use the terms equity, diversity, inclusion, we know that any of this social causation, these factors that we're talking about, falls under that rubric. So to get things published that have these kinds of descriptors or social locations, critical social location in them, becomes an issue. So I just wanted to flag that for us to teach and learn and talk about what this means in this field is really important. That there are ways that we're sort of standing up and saying no, that there are there are healthcare standards, there are standards of care, there are standards of service delivery that require us to be able to be conversant around these social determinants and the structures that will keep power and oppression in place. We're talking about bias, we're talking about privilege. And so that we're also required in that sort of lifelong learning within these fields to be able to be conversant and to be able to be having those internal dialogues, but then practicing that dialogue in our fields of practice, wherever that might be, within our small, ministries or small work settings or wherever that might be. And secondly, as the classroom is a microcosm of that broader DEM field, and we're talking quite broad because it includes folks like me that are working in sort of global humanitarian tech areas around climate change, and right now in the Maldives with a team, I'm working with a research framework there developed around climate change. We need to be conversant and able to be challenging each other as that authoritarianism is dehumanizing and threatening particular groups, either running trial balloons and saying, well, if we talk about this population, they're cast off, we're not interested. Trump is using terms like the homegrowns, the people that are citizens of the US. So within that classroom, we need to be able as instructors or as leaders in this field to also be challenged around our own privilege, our own bias, our own social location. And it's not an accident that Michelle is one of the students that was speaking in Italy, because well, my name is also Michelle. Michelle's nickname is Robomb, which is because she was super comfortable raising issues that in the classroom where students weren't necessarily used to talking about these things, they were like a bomb that went off in the class and had a big impact in terms of people's perking up their ears and then listening to how we as instructors maybe in a traditional setting might have been challenged by tough questions, but invited that discourse and dialogue as a learning community within these fields, as again, practice of holding the discomfort around being challenged and also being lifelong learners ourselves, especially as we're working with younger generations who are much more interested in fluidity around terms like gender. And what does that mean for us in a field? So I just wanted to throw it back to Michelle to say, was there anything you wanted to comment on around the learning experience? And feel free to say no, but it does enrich the learning environment for us as instructors and in the field to have people that can ask the tough questions and that can make it a brave space, not necessarily always a safe space, but one where we can step into it and have these tough conversations. Michelle,
And
did you want
just
to add?
before you jump in, Michelle, I will just say if anyone has questions that they want to put in the chat, feel free. We'll hear from Michelle and then we'll open it up for you. If you want to ask a question, just raise your hand or put it in the chat. Michelle? Oh, your mic.
Yes, sorry, it's much harder on my phone. I would say that my confidence and bravery was actually a product of my privilege and the structures that are afforded me as a nurse. Because that regular reflective practice means that I'm always curious and always asking questions, and not necessarily intentionally to set off bombs, but as part of demonstrating my own vulnerability, as well as maybe I don't understand this topic completely. I need some help as a way of modeling for other students as a way to learn. So
Great, thank you. Does anyone have some thoughts or questions? Mahmoud, I include you in that
Yeah.
to keep the conversation going. Yeah.
Yeah, thank you so much, Robin, for asking for the questions. Yeah, please, either write your question in the chat or raise your hand. As we promised, this session is going to be, actually a very dynamic and engaging session, and feel free to ask your question. We hope that we will have this dialogue.
Mark.
Yes.
I was just going to comment on something that Michelle Robichaud said earlier in regards to sort of reflective practices within our industry. And I come from a law enforcement background. I'm now retired, but that self-reflective piece is something that's not present in some organizations where it's very hierarchical and decisions are sort of rank-based and you have authority to make decisions and people are expected to do as they're told in many cases. So I've really seen over the last 10 years within law enforcement some pretty major shifts in the thinking that's going on around things like trauma-informed interviewing and the recognition of the impact of, in our case, it's criminal matters, but it doesn't matter whether it's that kind of an event, any kind of crisis or impact that a person experienced. When you're approaching disaster response, when you're in that operational sort of logistical perspective of trying to respond, that trauma-informed piece isn't something that in my industry existed 15 years ago, that now is starting to make its place more known. And the only place for me within my industry that I started to see this was actually not in my industry, but the people who came out of my industry and went into programs like the DEMN program, of which I'm a graduate of quite a few years ago now, almost 10 years ago. So I think it's really important to recognize that these kinds of spaces are really valuable for challenging our fixed paradigms, because I know when I came in, it was very much from an operational perspective. And even in my cohort, we had 2 other police officers, a soldier, a couple of nurses, a couple of paramedics. And it was very much that sort of hands-on operational response. And although the course now is a little bit different from when I took it, and it's interesting hearing the shift that it's made, it was still that push to make me rethink the way I approached problems and understood problems, and where I, both in my positional authority as well as my personal privilege, fit into that societal kind of response and the role that I played. So it's a very interesting way of being challenged to rethink both, sort of who you are, what you do, how you do it, and what will help you to be able to meet the needs of the community in the future. And there's a definite piece where social determinants of health, trauma-informed practice, all come into play in how, I was going to use another word, how things happen and how we deal with it.
Thanks for that, Mark. And I think it's also a demonstration, your own history and 10 years ago and your history in policing and noticing those differences. I think, I think in the description of this webinar, it talked about, how is this transforming the field? And we both said, well, we haven't personally done research. I think we can see it in the field. And I can certainly speak as somebody who's been involved with the program since it started, which is there has been and is a transformation in the field. And some of it, I think, is, I'll just toot our own horn, is due to graduates from the DEMN program, but not, obviously there's other things afoot, to really bring in more of that willingness to have more of a reflexive practice around how we do what we do. And I think necessarily so, that whether it's in policing or health or disaster management or climate action, whatever, that as we evolve, and as you said, Michelle, other Michelle, as we evolve and as we face some of the challenges, the authoritarian challenges and the challenges and undermining of much of what we're talking about, equity-informed, trauma-informed approaches, we're really beholden to each other and to the work that we do and to the people that we serve to really stay abreast of this and integrate these practices in. It's going to become harder and harder the next while to be able to do this work well if we don't. And that may be external pressures, but it's also, as you were saying, expectations. There are generations that are coming through that expect that to happen and should expect it to happen. So thanks for that, Mark. Others? Yeah, Chad.
Thank you. I appreciate the conversations and also just appreciate the approach. And I agree that the transition is happening in the respective industries, albeit maybe slower than we all want. But to that point, acknowledging that within the academic environment, people are probably coming already predisposed to be reflective and learning and open to some of these things. Just wondering if you have any thoughts, whether it's in the academic world or in industry, on how do we bring along the reluctant leaders, the reluctant organizations, and maybe experience that you have with that, in the classroom or otherwise.
Great question. And I think I have some thoughts. I think hopefully people come to a learning environment for that. They don't always, but I would say the majority do for sure. I'll speak briefly to it just based on not on academic experience, but work experience, which is, many years ago, I worked in what was at the time quite a unique police unit. I worked as a community counselor, as a psychologist, and my partnering with detectives in follow-up to extreme violence in relationships, so really high risk, vulnerable populations experiencing relational violence. And part of our work was directly with those survivors, but also part of our work was within the police organization itself. And part of it was framing, I don't know how successful we were. I think, sometimes we were successful, sometimes we weren't, but it was framing it in language and in terms of like, how does this help you do your job? You may not believe in it. You may think it's BS, whatever, but I can, and being able to provide real world examples and information on how it helps you do your job. When a police officer was said, well, I went to help a woman or went to a domestic violence call and this woman attacked me. And it's like, right. Okay. So let's unpack that a bit and, and talk about it. And like, what might you have done that would have helped you not get attacked and accomplish whatever your mission is, which is, maybe to arrest the guy or whatever. So I think that would be one thing I would say is bringing people along in ways that they understand helps them and meets their, values, because there are values in this that most people I think believe in, but when you get in the language of equity and social inclusion and intersectionality and whatever, people can get their backs up. But it's like if you love your family and you love your community, whatever. So I think that can help. Michelle and Michelle.
I got to the unmute first. Michelle, I'll throw it to you next. So for me, as someone has my finger in a bunch of different pies, what I would say is that we do know that there is research out there about how communities are exponentially impacted by climate change and disaster. And so some of it is, and we do this with students as well, anchoring everything that we're talking about within evidence, right? So for instance, the Commission of Environmental Cooperation has done a discussion paper around environmental justice, looking at 2S LGBTQ communities, but it also looks at race, and it also looks at compounding intersectional social location. And so it's bringing papers like that. It's bringing discussion papers. It's bringing the kind of Public Health Agency of Canada review from 2023 that breaks down an intersectional analysis of the impacts of climate change in Canada to the table and saying, here are groups who are exponentially impacted. And then the other piece for me is like the only organizations like in a healthcare institution, which is a big part of my background, Toronto Public Health and the Center for Addiction and Mental Health for many years, the only real transformative process that I have been part of around the social determinants, having an analysis around equity, human rights, and accessibility. So getting rid of that EDI language, because there is a backlash about that. But really looking at those pieces required policy, looking at bias, looking at privilege, looking at equity in the workplace, required training and education, and required measurement. And often it requires leadership. Someone's job is on the line if these things are not followed up on, if they're not measured, if we're not looking at bias-free hiring or what that looks like in our organizations. So I think that there are a series of levers that can, be pulled and put in place to make sure that this change happens across a field and within the kinds of fields that Mark has named and that we've been talking about too, but certainly also more broadly within the field and the practice and the discourse around DEM. Michelle, do you have thoughts?
Just quite quickly, that change management, like I'm trying to make change here all the time as well. It just requires an investment of time, an investment, as you were saying, of education. But it also requires at the base, like engagement with the people that you're trying to bring along with you. It can't be all forced and top down. You have to involve those who you're trying to bring to your message.
Nothing for us without us would be the short.
Yeah. We have maybe time for one more question, comment, reflection. Anybody like to jump in there? Mark.
Just one short, small thing. Where then it sort of takes a piece of that last question of, how do you change sort of minds and perspectives? For me, I'm now involved in teaching. So I teach in a police foundations program and behavioral psychology program. And so it's using the things that I've been exposed to with challenging your own perceptions of yourself and your place and your positionality, and incorporating that into my teaching so that it's reaching sort of the people going into the field earlier than I ever reached it. I'd rather have them hearing these things about who they are, where they are, what they think, their background, society, systems, whether it's systemic racism or policies and practices, and being told to make sure that you're looking at it critically and thinking critically about the things that you do and the things that you're being asked to do in order to make sure we're doing it for the right reasons and for the right goals. And that's not something that I heard in my career until I was in my 40s. It's just not the experience that is what's taught at, or at least at the time at the police academy kind of thing, or in your training. There's a definite shift with things like, wellness and understanding your own mental health and personal health, and that extends out into the health of others. But that's where you can also start to change things, is when you have the opportunity to have conversations with people about these issues and around sort of, well, for lack of a better term, our own identity, sort of professionally and personally with our practice. That's another place where you can start to sort of shift some thoughts and some perspectives, I think.
Absolutely. And I think, I was at a meeting in Vancouver a couple of weeks ago, looking at climate risk and vulnerability, and BC's engaged in provincial and regional and eventually local authority assessments that bring in climate. Anyway, the conversation was very much shaped by this recognition, and I would say it's a recognition that we have much to learn from Indigenous peoples about how relational this work is, that building relationships of trust and building relationships, yes, supported by policy and structures and systems, as Michelle was saying, but that establishing relationships with each other in ways that can support these conversations. And part of what we try and do in the course, which is build relationships with students and amongst students and with faculty in order to be able to create the brave spaces to support the courage to have these conversations. And it does require courage because it's not our day-to-day way of being typically in the world. And, you know, whether to be challenged and challenge each other in good ways, to be vulnerable and to share that vulnerability in good ways with each other, and to grow and learn together, as we must, and as we hopefully do, as you were saying, Chad, when we come into these courses, but in the field, in any field, but in this field of emergency management as well. And we do see this happening, and it is slower than we would like, and it's also not across the board. So I think it's an invitation to be really thinking about these things and to be exploring ways that we can contribute to this fundamental shift. I see that it's 1 o'clock, so back to you, Mahmoud. Thanks everyone
Sure.
for listening.